1 million. Seriously, just take a second to let that number sink in. Over 1 million sexually transmitted infections are acquired worldwide every single day. When we talk about public health, we are looking at a massive global scale. STIs aren't just some passing clinical issue, they are a daily reality that you, as a future nurse, are going to encounter constantly.
Hey everyone, and welcome to this explainer. I am so thrilled you're here because today we are tackling a really critical topic: sexually transmitted infections. But listen, we aren't just going to sit here reading from a textbook. This is a high-yield, purely focused clinical review designed specifically to get you ready for your ATI and NCLEX exams. We're going to strip away all the extra fluff and zero in on exactly what you need to know to provide safe, effective care, and honestly, to completely ace those boards.
Here's our roadmap for today. We're going to quickly cover incidence and mandatory reporting, bacterial STI manifestations, viral STI manifestations, priority pharmacology and interventions, and then we'll wrap up with patient teaching and prevention. Let's get right into it.
Section 1. Incidence and mandatory reporting. Protecting public health.
So, the World Health Organization identifies the big 8 STIs that account for the greatest number of infections globally. As a nurse, you've got to mentally sort these into 2 distinct clinical buckets: curable and incurable. Your curable bacterial and parasitic infections are syphilis, gonorrhea, chlamydia, and trichomonas. On the flip side, the incurable viral infections are hepatitis B, HSV, HIV, and HPV. You absolutely must lock down this foundational knowledge because it completely drives your nursing care plan. Think about it. Are we administering an antibiotic to cure the patient, or are we educating them on how to manage a lifelong chronic condition?
Okay, major exam alert right here. Put a giant mental star next to this. Confirmed cases of certain STIs legally must be reported to the local health department. This specific list includes HIV, AIDS, gonorrhea, syphilis, chlamydia, chancroid, and viral hepatitis. You might be wondering, why do we do this? Well, public health investigators need to trace contacts and advise exposed individuals to go get evaluated. As a nurse, you need to know for sure that this is not a violation of HIPAA. It's actually a mandatory legal requirement designed to stop the chain of transmission.
Moving on to Section 2, bacterial STIs, key manifestations, recognizing the signs. Take a look at this classic chancre. This is the absolute hallmark sign of primary syphilis. It usually pops up about 1 to 12 weeks after contact. But here's the highly testable fact you literally cannot forget. Despite how angry and inflamed it looks, this lesion is typically painless. That is a massive clue for your differential diagnosis. What's even trickier is that it heals and just disappears on its own within 1 to 5 weeks. Patients often mistakenly think, "Oh great, I'm cured," when the chancre vanishes. But unfortunately, the bacteria has actually just moved deeper into their bloodstream.
Now, contrast that with chlamydia and gonorrhea. The absolute most dangerous thing about these 2 incredibly common infections is that they are often completely asymptomatic. People literally have no idea they're infected, so they obviously don't seek treatment. But for a pregnant patient, this is a massive risk. If either of these is transmitted to a newborn during delivery, it can cause severe conjunctivitis or pneumonia. Because of this, your priority nursing intervention, and a total classic NCLEX question, by the way, is to routinely administer erythromycin ophthalmic ointment to all newborns right after birth to prevent these eye infections.
Section 3. Viral STIs, key manifestations, managing chronic conditions.
Remember that painless syphilis chancre we just talked about? Well, contrast that with these typical lesions associated with genital herpes, which is caused by the herpes simplex virus. HSV lesions are extremely painful, and on top of that, patients will often present with systemic, flu-like symptoms during their initial outbreak. So when you see painful vesicles and you've got a patient complaining of a fever or body aches, your clinical mind should immediately jump to HSV.
Here we have condylomata acuminata, which is much more commonly known as genital warts, caused by the human papillomavirus, or HPV. They usually have this soft, cauliflower-like appearance. While the warts themselves can definitely be managed, the absolutely critical patient teaching point here is the long-term risk. High-risk types of HPV are strongly associated with cervical cancer. Therefore, any woman diagnosed with HPV or genital warts must be educated on the absolute necessity of keeping up with annual Pap tests for early cancer detection.
Section 4. Priority pharmacology and interventions, essential nursing actions.
Let's do a rapid-fire run-through of this high-yield pharmacology table. This stuff is absolute gold for your exams. First up, penicillin G. That's the drug of choice for syphilis. What's your specific nursing intervention? You need the patient to hang around for 30 minutes after the injection so you can monitor for an allergic reaction or a Jarisch-Herxheimer reaction. That's a phenomenon that causes fever, chills, and muscle aches as the bacteria rapidly die off. Next, we have ceftriaxone for gonorrhea. This is given as an IM injection, and you must know, and honestly, you've got to warn your patient that this injection is quite painful. Finally, acyclovir for genital herpes. This one is an antiviral. Your key teaching point? You need to tell them it decreases the frequency and severity of their outbreaks, but it is not curative. The virus is still there, and condoms are still absolutely needed.
I want to pause for a second on this quote pulled directly from the source material. Patients who do not complete the prescribed course of anti-infective therapy may not be cured of the infection. The crucial takeaway here is that patient compliance is completely non-negotiable. It happens all the time. As soon as those uncomfortable symptoms disappear, patients want to stop taking their meds. Your job is to make sure they understand that stopping early leads to a relapse, and even worse, it contributes to antimicrobial resistance, which is becoming a massive global threat.
And finally, Section 5, Patient Teaching and Prevention, Empowering the Patient.
Believe it or not, the exact steps for properly using a male condom are highly testable material. So let's quickly walk through them. First, always use latex or polyurethane condoms. Natural membranes actually allow tiny pathogens to pass right through. Second, and this is a huge exam trap, only use water-based lubricants. Oil-based lubes will break down the latex and cause the condom to snap. When applying it, it goes on an erect penis, leaving a little space at the tip. You must pinch the air out of that tip to prevent it from rupturing during use. And finally, withdraw while holding the base to prevent any spilling. This seem like simple steps, right? But they are absolutely critical for disease prevention.
Have you ever heard of expedited partner therapy, or EPT? It's another vital public health tool you need to have in your back pocket. This is a practice where a patient is given prescriptions or actual medications to take home to their sexual partner without that partner even needing to come into the clinic for an exam. It's an amazing way to break the chain of reinfection. Now, to facilitate all of these interventions, your communication must be completely non-judgmental. If you look shocked or disgusted, your patient is going to shut down immediately. A patient who feels shamed simply will not give you an accurate sexual history. And while we always teach safer sex practices, remember to reinforce that abstinence is the only 100% effective way to prevent STIs.
Let's wrap up this explainer by putting your retention to the test. This is a real, next-generation NCLEX-style select all that apply question. Ready? Which of the following STIs can usually be cured with antimicrobials? 1. Gonorrhea. 2. Herpes simplex. 3. Syphilis. 4. Trichomonas. 5. Chlamydia. Pause for a second, think back to our buckets, and lock in your answer. You got it? The correct answers are 1, 3, 4, and 5. Herpes simplex is viral and therefore incurable. If you nailed that, you are well on your way to mastering this material. But looking beyond the exam, I want you to remember that statistic from the very beginning. 1 million new infections today. The real question is, how many of those chains of transmission are you going to break in your future nursing practice? Keep reviewing those high-yield facts, and I'll see you in the next explainer.